Good evening, everybody. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, benign prostatic hyperplasia, also very commonly known as BPH. Benign prostatic hyperplasia, BPH, is the non cancerous enlargement of the prostate. Usually, it begins in the 50s in men, and which in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and is the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as the theater, cinema, etc., rather difficult. A doctor, such as a urologist, can treat this condition and help the patient to get relief. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Manish Kumar Singh, MBBS, MS, DNB in urology. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He is currently practicing at Shubh Care Nursing Home, Patna. Dr. Manish Kumar Singh has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Manish Kumar Singh.
Thank you, madam, and good evening to you all.
So, Doctor, it's such a pleasure to have you with us, and we are going to discuss about a very important topic, which is BPH. And BPH is an important topic to discuss because it's very common after a certain age in males, because men do have this organ called prostate. So, enlargement is, with aging, the enlargement is very common. So it becomes even more important to discuss it. So, first of all, doctor, we would like to understand what is BPH.
Actually, before telling about BPH, I want everyone to know what is prostate. It's actually a walnut-shaped gland that is located at the bladder neck. That is the area where the bladder joins with the urethra. BPH is enlargement of the prostate, which is non-cancerous. The progression of the age, actually, which is androgen dependent, the growth of the gland takes place, which causes the impediment in the flow of the blood, flow of the urine from the bladder to the urethra. And this condition is known as BPH, which can be expanded as benign prostatic hyperplasia, which causes a constellation of the symptoms and which causes a trouble in a certain age group of patients. And that's a disease specific to a certain group of patients who belong to ages above 50 years and above.
Okay. So, what are the causes for BPH, doctor? Is it just the age, or there are other factors as well responsible for BPH?
Actually, the exact etiology of BPH is still under research, but some theory states that it's an androgen-dependent growth. Androgen, which is the sex hormone which is present in men, that causes the growth of the prostate gland, causing as a result of which there is impediment in the flow of the blood from the bladder. And because besides, it has been seen that in those patients in which there are the testicles has been removed from some other cause, the disease of BPH is seen in less proportions. Besides, studies have demonstrated that raised level of estrogen is found in those patients which have BPH. Therefore, it can be said that BPH is caused mainly due to the raised androgen level in those cases.
Okay, doctor. Now, doctor, what are some of the symptoms associated with BPH?
Madam, there are a constellation of symptoms that are seen commonly in patients of BPH, commonly witnessed as increased frequency of urination. That means which is witnessed as increased frequency seen in of the urination seen in patients who are suffering from this problem. Besides, there is urgency in which there is difficult to defer the flow of urine. When the patient feels a sense of urination, he is unable to defer by it. Besides, there is a nocturia in which the patient gets up often in the night to void. Besides, there is a difficulty in initiation of the urinary flow. There is intermittency in the flow. Besides, the patients often feel that there is sense of incomplete voiding, and besides, often they suffer from recurrent attacks of urinary tract infection.
Okay. Now, doctor, as you explained that, after a certain age, the symptoms are very prominent. BPH takes place after a certain age. So is it just after a certain age and or people who are not yet 45 or 50, who are really young, can also get enlarged prostate?
But actually, the enlarged prostate and BPH are not synonymous because if enlarged prostate is not causing any symptoms, we need not to treat them. And even if minimally the prostate is enlarged and it's causing troublesome symptoms to the patient, the treatment need to be prescribed to them. So BPH is oftenly seen in about 50% of patients in age group 50 to 60 years of 50 to 60 years, and it's seen in 90% of patients who aged above 80 years. But in cases of those individuals who have family history of BPH, it is also seen in those patients who are having age as early as 40 to 45 years now.
Okay. Now, doctor, what happens? Because we already know, as you have told us, that aging is one of the major, concerns or one of the major factors responsible for BPH. Now, the thing is, many a times when people are suffering, they have these symptoms, but then they won't come up, talk about it, and won't go and take advice from a doctor or a qualified urologist. When someone, asks them that why you are not going or taking, treatment, they'll say that I'm diabetic, because diabetes is also very common, and with age, many people in India are suffering from diabetes. So they'll often say that I'm suffering with, diabetes, and the symptoms are associated with diabetes, or I'm aging, so I'm bound to have these symptoms. So many times people just, accept these symptoms, they start living with it. They are suffering, but they are suffering in silence, and they are not coming out of it and talking about it. So what's your advice on that?
Madam, actually, the means in India, it's a common scenario that we take some over-the-counter drugs and start, or we consider that as a age-related symptom. But means if the patient is having nocturia or the symptoms, the constellation of symptoms, which I said that like increased frequency during the daytime, urgency, nocturia, there is hesitancy or a difficulty in the initiation of the urinary flow, then he should consult means a proper doctor and take a proper list of investigation and undergo the prescribed set of treatment that is prescribed to them, because the quality of the life that is actually hampered or that is produced as a result of the symptoms that's produced by the BPH is quite troublesome and need to be treated at the right time, because ultimately there are the complications that are produced are often untreatable if they are not diagnosed and treated at an early stage.
Right.
No doubt that diabetes and those patients who are taking some antihistaminic drugs, they do get these symptoms aggravated by that medication. But still, I don't think it's a wise idea to ascribe that these symptoms are solely produced by diabetes. BPH has certainly got a role after certain age group.
Right. I think that's the bottom line. So viewers, if you see anybody who's, 40, 45 plus or immaterial of the age, if they have these symptoms, then it is quite possible that if that person is a male, then it is due to BPH. So please go and consult a qualified urologist. That's really important. And as you said, doctor, we have this tendency in our society that we'll go for over-the-counter medication because it's easily accessible. We'll trust our chemist more than the doctor, or we'll do some home remedies, some dadi ka nani ka nuska. These days, there are so many influencers on social media, and they have quick fixes, quick remedies for almost every problem. They also have remedies for BPH or the symptoms at least. So, what's your say on that? What's your take on those social influencers or home remedies? Because we tend to waste a lot of time over it, right? So, what's your take?
Actually, that can be taken away by means the top-down approach. That if you see the complication that is produced by the BPH, or suppose the prostate is enlarged, or it's the cause is not BPH always. In about 2 to 3% of cases, there is a bit of malignancy, so commonly known as cancer, that is attached to it. So that need to be diagnosed early. Besides the complications like that decompensation of the bladder, the kidney failure, or that causes that means a recurrent UTI, loss of blood in urine. These are quite dreadful, and that can be prevented if you approach the doctor at an early stage and get it evaluated and treated in a proper way. So I need to say that a little bit of knowledge is quite dangerous. So every disease need to be approached and evaluated and treated in a proper way by an experienced person.
Right. And as there are potential complications if BPH is left untreated. So please don't ignore these symptoms. If you have these symptoms, go contact a qualified urologist and take the treatment. And as the doctor has already said, the sooner you go, the better the treatment will be, the more, less complicated. It will be easy to get you treated. Now, the thing is, doctor, yeah, because we have talked about it, that many times people assume that it's due to our age or other factors. Many times they won't even admit or acknowledge that it could be due to BPH. Awareness is not there. We are also taking this session so that we can spread awareness on BPH. See, a person is so scared because they don't know when they'll go to a doctor what all tests will they prescribe or get done. So we would like you to shed some more light on what is the basis of diagnosis. How do you diagnose that it is BPH? Are there any tests that get to be
Okay.
done?
Now, actually the diagnosis starts straight away from the history, madam. The patient, we evaluate the patient on the basis of the complaint he is presenting to us with, and we take the family history. Besides, we do the physical examination, and with the digital rectal examination, we look for the consistency and the grade of the enlargement of the prostate. After that, we prescribe a set of investigation, madam, starting from the routine microscopy and culture sensitivity of the urine. We prescribe the ultrasonography of the kidney, ureter, and the bladder, and with the prostate is included. We want to know the status of the bladder, means how much of urine is left inside the bladder even after that patient is voiding completely. Besides, we want to know the urotometry, that's the flow of pattern of the urine the patient is having, which guesses and which enables us to diagnose the disease or she is having. If we are not able to reach after these sort of investigation to a proper conclusion, then we can go for other investigations like urodynamics and cystoscopy and things like that. Now, by these, we are able to reach the cause of the which is causing problems to this patient and able to treat accordingly.
Okay. And as you also mentioned, doctor, that BPH is one thing, it's benign, but then it can be, there are possibilities that it could be malignant as well or cancerous as well. Now, is what all tests you have just mentioned, are they also, good enough to tell us that it's benign or it's malignant, or there are some specific tests for that as well?
Madam, actually, one test I said was during examination, we do the digital rectal examination in which we look for the consistency of the prostate, if it is soft, it is firm or hard. If it is hard, then it's going towards malignancy. Besides, we prescribe serum prostatic specific antigen, where the level of which guides us in whether the patient is having benign enlargement of prostate or whether it is cancerous. If the serum PSA is going towards malignancy, then we can go for finger-guided or truss-guided biopsy of the prostate, in which a tissue is of the prostate is taken and it's examined microscopically to know the glandular architecture, and by this we are able to know it is malignant or benign enlargement. And the series of tests means it follows if we get the hint of malignancy, madam.
Okay. God forbid it, if it's at all malignant, what's the procedure then, doctor? What all? Because I know that prostate cancer is one thing which is quite common, but then it spreads really slow because cancer has this property where it spreads very rapidly. But on the contrary, prostate cancer is one thing which is a little bit slow. So if it's malignant, God forbid, then what's the line of treatment?
Madam, even if the prostate means we find that the enlargement is malignant, we have got techniques by which the malignancy can be cured or the disease can be cured completely, or sometimes some symptomatic relief can be provided to the patient. It all depends on the means the physical fitness of the patient, the age of the patient, and the quality of the cancer we get. Means the how severe the disease is and what is the stage of the disease. That depends. The further management depends on the combination of all these factors, madam. And besides the symptoms which the patient is having, suppose he is having means bladder outlet obstruction due to the enlargement of the prostate, then we tend to help the patient to get rid of that. And we have got techniques like we have got the androgen deprivation therapy, which can be given medically, or besides, we have got the surgical removal of bilateral testes, which often helps in curbing the growth and spread of the tumor, the cancer of the prostate, madam.
Fair enough. And doctor, about BPH, what are the treatment options available?
Madam, starting from we start from lifestyle modification, madam, in which we ask the patient for weight reduction. We prescribe a certain quantity of fluid. Generally, it's about 2 to 2.5 liters in 24 hours, and generally we ask him to limit the intake of the fluid post 5 p.m. in the evening, so as to decrease the urine flow in the night. Besides, we ask him to abstain from intake of caffeinated drinks and alcohol. Besides, we ask the patient that if he is having some antihistaminic drug, he should abstain from that, and or he can probably switch to some substitute of that. The medical management involves the combination of drugs in which the alpha antagonists are prescribed to the patient. Besides, 5-alpha adrenergic receptor, 5-alpha reductase inhibitors are prescribed, and the combination of two drugs are prescribed. It depends on what is the size of the prostate we are having on the ultrasonography. The type of medication we prescribe depends on the symptoms he is having and the size of the prostate that we get on ultrasonographic finding. And if he is not having that sufficient quality, sufficient or satisfactory quality of life post medication, or if he is not convinced enough that he should continue the medication lifelong, then we have got surgical options in which we have got minimal invasive therapies like that urolift or that transurethral incision of prostate. Besides, we can have got we have invasive procedures like transurethral resection of the prostate, or we have got the holmium laser enucleation of the prostate, depending on how big the prostate he is having now.
Right. We have a similar question or relevant question rather by Jay Jagan. So Jay's question is, what is the role of minimally invasive procedures like urolift or RISM in treating BPH, and are they suitable for he's asking about his case, but then we don't know exactly his case. But in general, are they suitable for everyone?
Madam, suppose the patient is not fit enough that he can go invasive procedure like the TURP or holmium laser enucleation of prostate. Besides, he is not able, he is not ready that I will not continue the medication lifelong. Then in that cases, we can go for minimal invasive procedures like the urolift, in which means the prostate, enlarged prostatic lobes are tugged in specially designed sutures so that the path which is impeded by the enlarged prostate are actually separated and the path is thereby cleared. Thereby the flow, the obstructive symptoms that were produced by the enlarged prostates are relieved. In Regium, there is vaporization of the prostate by specially designed apparatus. These sort of minimally invasive techniques have got a role in those patients who are not fit for invasive surgeries, madam.
Okay, doctor. Doctor, we always say, especially in medical field, that prevention is always better than cure. Now, when we know that after a certain age, there are good chances that in men, prostate, BPH can come, or this condition can persist. Now, what a person, a male in general, can do to prevent BPH or at least prolong it?
Madam, by proper bladder habit, and by intake of a balanced diet in which the fluid intake should be regulated about 2 to 2.5 liters in 24 hours. Abstain take of fluid post 5 p.m. in the evening. Besides abstain caffeinated drinks, regular exercises, of obesity should be prevented. And besides, one point I want to stress is that if one is constipated, he should try to get rid of it, because these all sort of things actually aggravate that urinary symptoms. Little bit of what he's having, if the constipation is associated with it, that will present in more severe form. Though, so these points should be taken care of. Besides, if you one study says that if you include sufficient fruits and vegetables, and especially fish, these have shown to retard the progression of prostatic enlargement. Thereby, the symptoms of the BPH can be prevented in this way.
Right. So a healthy lifestyle, a healthy bladder habit, they can actually go a long way in preventing or
Yeah.
at least prolonging BPH. We have one more viewer with us, Abhishek Mishra, and his question is: are there any medications which can worsen BPH symptoms or interact with BPH medications?
Yes. If suppose someone is on beta agonist, like is having the inhalation for asthma or COPD disease, or he is having some antihistaminic drugs like which contains diphenhydramine, that interacts with the force which the bladder is contracting. And because in BPH there is already impediment to the flow of urine, if the bladder doesn't generate enough forces, then these drugs can aggravate the symptoms of BPH. So they should especially be inquired to of from the person who is having symptoms of BPH, and should be substituted if possible. As far as it is possible, you should substitute those drugs from other drugs which do not interact with the bladder contractility.
Okay. We have one more viewer with us, Bhavesh Mittal. His question is: are there any natural remedies or supplements that may alleviate BPH symptoms?
Madam, natural remedies, and there are some phytotherapies that have been advocated, but the results that have been produced are not satisfactory. And besides, weight reduction has been seen to some extent, and the amount of the physical activity one is having, that seems to means proven of some sort of remedy to the symptoms of the BPH, madam. Besides, balanced lifestyle and intake of fluid in a proper way should be equally distributed. And besides, the bladder should be trained to be voided. To that, one person should be trained that he should void at a certain interval of time, even if he is not having the urge. Besides, we prescribe timed voiding and double voiding, in which if the bladder is not emptying in a single episode of micturition, then he should wait in the washroom for some time, and after that he should void even if the urine is not coming, so as to empty the bladder. That will actually curb the symptoms of BPH, madam.
Okay, so a healthy bladder habit is very important
Yes.
because people are not that aware of it, doctor. Right? We have never been taught about it that way. Because you are here with us, and it's such a pleasure to have you with us. We would like you to tell us how to, adopt a healthy bladder habit. What are the small things that we can do, make it in practice?
Madam, the bladder should be, so actually the bladder stays in 95% of times in resting stage, and the adequate flow of urine acts to clean the bladder inner surface. We need to prevent the adhesion of the bacteria. So the fluid intake should be adequate and should be equally divided. Besides, the patient should be trained that there should be ample distribution time between two episodes of micturition. The, the patient should curb the false sense of voiding, and he should train himself so as to create sufficient interval between two episodes of voiding. And there should be a timing. The time should be means fixed in the diary. Means one should have a fixed time of voiding between his life, that he should void at certain interval of time, because often we have a false sense of voiding, which is often perceived as increased frequency, and These sort of things should be prescribed to the patient. One should, while micturating, one should not be in hurry. He should empty the bladder in a relaxed manner. If we go for double micturation, if required, besides, one should get rid of constipation, because constipation, the anal and the urethral sphincters have got same nerve supply. So if one of your area is disturbed, naturally your flow, the other flow of the urine will also be disturbed. So these things actually go together and should be managed accordingly, madam.
Okay, doctor. Doctor, again in our society, we have this notion that drink a lot of water. We never emphasize on the, on the word adequate water. We'll say a lot of water. That too, water. We don't calculate fluid. We all, liquid intake and calculation. So, what's your definition? Because initially you said that it's important that we also check on our liquid intake, and you also said that specifically after a certain age, if these symptoms are there, then you normally ask your patient not to have fluids or liquid intake after 6 or 7 in the PM maybe. So, what's the definition of adequate water? How much water should we drink?
Actually, the a healthy person should have about 2 to 2.5 liters of fluid, madam. It does. By fluid, I mean not only water, any sort of fluid which is going to the body, means whether it's juice or whether you are drinking milk, all should be included. And it should be equally divided, means one should abstain from drinking 1 liter of water at one time and in a single episode, and after that, in the next 4 to 6 hours, is not drinking any fluid. And that's means not a wise thing to do. The fluid intake should be equally distributed and should be limited to about 2 to 2.5 liters. In the night, we generally advise those patients who have to get up often in the after we have to get up often at night to void, because we need to curb the urine production at night. So we advise those patients to abstain from drinking excess fluid post 5 p.m. So I means depending on the body weight, actually the fluid calculation should be made. If one is weighing about 60 kg, then I think 2 to 2.5 liters of fluid equally distributed in 24 hours is a wise thing to do.
Okay. We have Sanjeev with us. His question is, can you explain the potential benefits of prostate-specific antigen PSA testing for BPH, and how frequently should it be done?
Okay. Madam, prostate-specific antigen is a organ-specific, means tumor marker. Means doesn't matter. Doesn't mean that if you have got a PSA in blood, you are suffering from malignancy. That is seen in the blood. We tend to utilize it in cases of patients who are having prostatic symptoms, and we found that prostate enlarged on the digital examination, who are having ages 50 years or above, or if one is having family history of prostatic cancer, then we tend to be little liberal, and we generally go for PSA testing in those patients who are having as younger as 45 years. We tend to take it as a tumor marker, and we have got certain prescribed limit, like 0 to 4 nanogram is generally the limit in which the normal individual have the PSA value. If the PSA value suppose is between 4 to 9 nanograms, it's a borderline thing and need to be re-evaluated after the 3 weeks. If it is above 9 nanogram per ml, then it goes towards state of malignancy and should be evaluated thoroughly. Besides, we have got PSA derivatives like total PSA, free PSA, bound PSA. These all help in the diagnosis of prostatic cancers. Thereby, it's a useful tool which not only helps in the screening of prostatic cancer, but if one is diagnosed with a case of prostatic cancer, then we tend to take it as a mean by of knowing how effective our treatment is going by the PSA value. Post treatment, if the PSA value is decreasing, that means our treatment we have prescribed the serum prostatic cancer, means the prostatic cancer disease is going in a right pathway. That is, it is not only a screening and diagnostic tool, it is also a mean to check whether our treatment prescribed is going the right direction or not.
Okay, doctor. We have Pratham Singh with us. His question is, how can I manage urinary symptoms associated with BPH on a day-to-day basis?
Madam, we in these cases we ask the patient for a bladder diary in which we ask the patient to drink the fluid from a 1 liter bottle so as to know how much fluid he has consumed. Besides, we ask the patient to void in a Europot which has got markings on them so as to know how frequently he is urinating. We need to means document that on a piece of paper, and we ask the patient to come back to our OPD with that paper. He is voiding in that Europot. By that we know how frequently he is voiding and how much amount he is voiding. So if he is having means increased frequency is not voiding well, then we prescribe that bladder training in which timed voiding is prescribed, and we we prescribe those medicines which decrease the contractility of the bladder. Besides, by the use of the uroplometry, we are able to know how the flow of the urine is going, and we are able to prescribe that alpha adrenergic and antagonist drugs, which tend to open the prostatic tissues, thereby decreasing the impediment in the flow of the urine. So in this way, besides we ask the patient to drink fluid in a correct manner. We ask them to abstain from caffeinated drinks and alcohols. We ask them to get rid of constipation. We prescribe drugs for the treatment of constipation. We ask them to have the decrease in their body weight and do regular physical exercises. We prescribe medicines depending on the symptoms they are having. In this way, we manage the urinary symptoms.
Right. Do you also suggest, doctor, that after a certain age, men should go and get a regular checkup done so that they know that what's up with their prostate, or it's just symptomatic? So only if the symptoms are there, if it's bothering you, then you should go and consult a urologist.
Madam, as I said earlier, that BPH, symptomatic BPH and prostatic enlargements are two things. If the patient is having, even if he is having 100 grams of prostate, it doesn't mean that he requires treatment. And if he is having 30 grams of prostate and the symptoms produced severe enough to means affect the quality of the life, then he requires treatment. So I don't think the regular checkup or routine checkup is needed if he is not having any symptoms. Provided if he is having some family history of the prostatic cancer, then he should start the evaluation of that prostate status, whether it is whether there is any conversion to malignancy, right from 45 years of age. Otherwise, routine checkup is not mandatory if no symptoms which I means counted like frequency, urgency, nocturia. If he is not having that, checkup is not required.
Okay, doctor. I'll take one more question from our viewer, Jay. One more question from Jay. So, can lifestyle changes such as diet and exercise help manage BPH symptoms? Though we have spoken about it, but still, doctor, would you like to shed some more light on it?
Yes, madam. Lifestyle, we actually the symptoms one is having is not only from the prostatic enlargement, but also from the irregular lifestyle he is having. So right away, if he's having decreased physical activity need to be increased, obesity need to be cured, constipation need to be treated. Besides, fluid intake habits should be managed and should be explained correctly. Besides, one should abstain from alcohol or caffeinated drinks, which are known to be diuretics, which facilitates the production of the urine. These need to be abstained. So lifestyle has got an important role, and generally, we in certain group of patients, we do not prescribe medicine. We generally ask them to have lifestyle medication, and if that is not working, then the second line of treatment is medication.
Okay, doctor. And doctor, before we sum up the whole session, any take-home message for our viewers?
The take-home message is that don't take BPH as a disease. It's enlargement of the organ which is found in major population of the patients, and that need to be evaluated. So try to contact the doctor earlier, because the late complications are often unmanageable, and so early treatment, early diagnosis can prevent from other untreatable complications like kidney failure or recurrent UTIs. So early contact the efficient person who is expert in handling those cases so as to prevent complications, latter complications.
Okay, doctor. So the bottom line is, in case you have these symptoms, please go and visit a doctor, visit a qualified urologist as early as possible. Plus, if you have a family history of malignancy in prostate, prostatic cancer, then again, you need to go and consult a doctor. Thank you so very much, Dr. Manish Kumar Singh. It was wonderful talking to you. Thank you for your valuable time. And it has been quite an informative session for our viewers, I'm sure. We really look forward for many more such sessions in coming times with you, Dr. Manish.
Thank you, madam. Thank you, everybody.
And viewers, thank you for your excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Goodbye.